Today we're tackling women's health issues. We talk with OBGYN and infertility specialist Dr. Carolina Sweldo to discuss PCOS and how it affects fertility.
So PCOS stands for polycystic ovarian syndrome. A lot of times people misinterpret, it's a misnomer, and they think that it's cysts on the ovary. And it's actually not cysts on the ovaries. It's really more about hormone excess. It tends to see elevated androgens, specifically testosterone, which is what most people know, as well as estrogen. And so there's an interference between the talk of the brain and the ovary that doesn't allow for normal ovulation to happen. These patients typically present with irregular cycles, so they'll bleed maybe once every 3 or 4 months. They can also present with other signs and symptoms, things like acne or hair loss, weight gain, etc. So it's a multifactorial disease that presents with varied clinical signs and symptoms. Women of reproductive age, we know that PCOS affects approximately 8 to 12% of them, so it's actually super common in women of reproductive age. It typically will present in late adolescence or early adulthood, but really any woman presenting with irregular menstruation should be at least thought of as one of the possibilities. We believe that there are multiple things that contribute to PCOS. We believe there's a genetic component to it. We believe that there's some sort of hereditary issue. We also know there's a metabolic component, so many of these patients tend to have a high BMI, they tend to be obese, and that can also play into a worsening of the hormones. And we believe that there's a hormonal component, so again, that crosstalk or that dysregulation between estrogen and testosterone. PCOS affects fertility in a numerous amount of ways. So the first one, which is typically what patients present for, is that irregular menstruation. I'm not getting my cycle regularly. What does this mean? And the kind of baseline one-liner is you're not ovulating regularly. So if you're not ovulating regularly, then obviously fertility is going to be impaired. PCOS is a chronic disease. It should be treated always, not just in the setting of fertility treatments. So if these patients are not desiring fertility but do have PCOS as a diagnosis, they should also be actively managed. The number one thing that we always start with is lifestyle changes. So if the patient does have an elevated BMI, a lot of times normalizing that BMI is sufficient to actually regain normal menstruation. But the biggest one, the take-home message that I always tell patients is risk to the uterus. So if you have elevated estrogen and you're not seeing any progesterone, which happens after ovulation, then the cells of the uterus are only seeing estrogen, which is a stimulant. And so those cells have the potential to become abnormal, precancerous, or even cancerous. So those patients are at increased risk for cancer of the uterus or endometrial cancer. So the one takeaway, if they remember nothing else from my visit, is you want to protect that uterus. So if you're not trying to conceive, you want to make sure you're getting progesterone, whether it's from a birth control pill, whether it's from another medication called Provera. There's several other ways to manage that. Even an IUD, if it's a younger patient who doesn't want pregnancy for a while, a progesterone IUD could be a great option. But definitely you want to make sure that you're combating that high estrogen environment.